Good morning, everyone. I'm Dr. Linghu Enqiang from Chinese People Liberation Army General Hospital, the president of Chinese Society of Digestive Endoscopiology, CSDE. It is my greatest honor to be here to share my option and research with you. Today, my topic is comparison between super minimal invasive surgery and minimal invasive surgery. Let's move to our topic. First, what's the meaning of the Smis? Some experts may not be familiar to this concept. Super minimal invasive surgery, SMIS, is defined as coronary disease while perceiving the integrity of human organ anatomy. Smis could successfully cure disease without damaged organ structure and function, normal survival time, and post-operative quality of life. Although minimal invasive surgery, MIS, is less invasive than traditional open surgery, both failure to maintain the integrity of organ while resection the lesions to data means does not change the treatment model used in traditional open surgery, namely resect not only lesions but also partial or complex select organ, lead to loss of some organs, anatomic reconstruction of remaining organs, Smis, which cure disease with only resecting lesion will be upcoming model. Then we will talk about the application of Smis. For most of benign disease lesions, Smis is believed to achieve a therapeutic effect similar to that of surgical treatment. For malignant lesions, Smis is mainly applied to those in early stage. For lesions in advanced stage, traditional open surgery and MIS are still regarded as the option resection models. You may have preliminary understanding of the Smis now. However, some may be confused with the Smis is equal to endoscopic surgery. The answer is no. In addition, it does not mean that endoscopy option for classified as Smis. Whereas laparoscopic and thoracoscopic as classified NES. Some options may and laparoscopic and thoracoscopy denote the effect anatomic structure of organ and should also be regarded the same, such as video-assisted thoracic scopy, unification, while only resection lesions. Surgical option, no matter endoscopy or video-assisted thoracic scopy, should be regarded as Smis. If they did not affect anatomic structure of organs, white cold disease. These figures demonstrate the Smis with orange color, and non-Smis white blue color. We can see that endoscopic portion implantation is not regarded as Smis, while thoracic or laparoscopic nucleation is regarded as Smis. To make you have a better understanding, I will demonstrate the compare between Smis and NIS according to the location of lesions. First, the esophagus lesions. While treating esophageal lesions, SAMS may aim at four types of lesions. The first, mucosal lesion, such as early cancer. The second one is submucosal lesion, such as submucosal tumor. The third is muscular peripheral lesions, such as submucosal tumors and the achalasia. And for others, we will develop. SAMS can maintain integrate of the esophagus while MIS briefly integrate of the esophagus. SAMS resection lesion only while resection lesions and partial of the esophagus and part of the esophagus, making the integrate of remaining esophagus and stomach. SAMS does not affect life quality and lower survival time after SAMS while decrease the post-operative life quality, leading to structure of the stoma, leading dysphagia, Marcimus reflex. Taking esophageal early stage cancer as, for example, SAMS only resect the esophageal mucosa and maintain the integrate of the esophagus. However, MIS resection partial of the esophagus with cancer lead to the post-operative structures of stoma and dysphagia. Then we will talk about the cardiac lesions. SAMS is the main action applied to the following lesions: the mucosal lesion, such as early stage cancer, submucosal lesion, such as submucosal tumor, muscular peripheral lesions, submucosal tumor and achalasia, and gastroesophageal reflux disease, use the clip band ligation onto reflex therapy, for example, and either undeveloped. Same maintain the integrate of the cardia, while MIS break the integrate of the cardia. SAMS resection the lesion only, while MIS resection lesion under the cardia. Esophagus and stomach will fit together. SAMS does not affect life quality and lower survival time after SAMS. However, MIS decrease the post-operative life quality caused by the losing the cardia, inducing dysphagia, reflex, retrosternal pain. Patient must sit in the bed post-operative option to decrease reflex. Taking cardiac submucosal tumor for example, the steer successfully resection the tumor while maintaining the integrator of the cardia. However, laparoscopic surgery resection not only the tumor but also the cardia causes the stomach or gastroesophageal reflex. SAMS mainly aim as 6 type. For example, the first one is the mucosal lesion, such as early stage cancer underneath. The second one is submucosal lesion, such as submucosal tumor, the muscular peripheral lesion, submucosal tumor, obesity, overstage suture, the gastroparesis or pleural stenosis, GPOM, and others. Taking gastric cancer as an example, ESD resection the tumor while maintaining the integrity of the stomach. The gastric anatomy is normal after ESD. MIS resection not only the cancer but also part or total of stomach, such as the Beers 1 and the Beers 2. This is, for example, this is GIST cancer. And with resection mucosa, I use a clip and cutting the muscular prepare. Of course, this is the gist is close to the abdominal cavity, so you can find a big hole. For this kind of method, we use only that is routine the endoscopy treatment. So we treat it that is suture the muscular prepare, and at the same time we perform the resection. And now you look at that we use the clip to close the muscular prepare lesion. And at the same time, we resection the tumor. If you're familiar with this kind of type of the operation, that's an easy case. That's yes, that is the sign to the abdominal cavity. Then we use the clip, fix the muscular preparation. For this kind of disease, we use the two-layer suture. The first one is a muscular preparation, and the second one is mucosa. That's we finished this case. And then we will make the compare on duodenal lesions. Same aims at mucosal lesions such as early cancer or niche and lateral spread tumor, submucosal lesions such as submucosal tumor, muscular purple lesions, submucosal tumor, and benign duodenal papillary tumor and others. The same can maintain the integrity of the duodenal and the integrity of the in all the sphincter. However, mass break the integrity of the duodenal, making the reconstruct of the stomach and the jejunum. Same resection only, while resection and the portion on the total duodenal stomach will also resection in some cases. The life quality and the normal survival of the patients are not effective of the same. However, this decrease post-operative life quality and caused by the reconstruction of the gastrointestinal tract and leading to anastomosis, gastric stasis in neurotraction and post-operative volis marsis. And this is taking the duodenal net, for example, same mating the integrator of the duodenum, and this is the lesion, and this is after the coronary disease, and the duodenum is still here, and this kind of sign is minimal invasive surgery, and that's the reconstruction of the gastrointestinal tract after gastroduodenal stone. So this is a part for the pancreas. The pancreas shoots system and world of necrosis and others. Same mating integrator of the duodenum and the pancreas. However, Mis break the integrator of the pancreas, making reconstruction of the stomach and the jejunum or losing of the partial pancreas. During the same mental stand or plastic stand is pleased for the drainage, and the PPC is treated by the drainage instead of the resection. Laparoscopic distal pancreatic tectomy or pancreatic duodenectomy is operation to resect the PPC, partial pancreas, duodenum, distal stomach, and partial jejunum during Mis. Seems does not affect the life quality and the longer survival time. However, Mis decrease the post-operative life quality and cause the loss of the pancreas or resection of the stomach and the smell intensity need to understand most stasis, gastrostasis, internuration, both the predatoris, marsis, pancreas fistula. And the left figure showed the procedure of the US guarded stand replacement systems. And this is the right, that is the image show the laparoscopic distal pancreatectomy or pancreatic For biliary tract gallbladder lesions, seems mainly aimed at gallbladder stone and biliary tract stone and suppurative cholangitis. Seems commenting the integration of the biliary tract gallbladder and at least maintain biliary sphincter, while Mis breaking the integrator of the biliary tract or gallbladder, losing gallbladder or reconstruction on biliary tract. Cholecystectomy is used to remove stone or infection, while resecting gallbladder and biliary tract incision is made to remove stone during Mis, causing the biliary fistula, biliary structure, and dyspepsia. Taking gallbladder stone, for example, classoscopic cholangiostomy is used to remove the gallbladder stone while maintaining the integrator of the gallbladder. Laparoscopic cholecystectomy is used to resection of the gallbladder to treat gallbladder stone. Let's talk about the colorectal lesion. Seems is mainly to mucosal lesion, such as early stage cancer, NET, PROP, lateral spreading tumor, some mucosal lesions such as some mucosal tumor, muscular perforations, some mucosal tumors, and others. But these figures show the endoscopic view of the cells to maintain the lateral spreading tumor cancers. This is cells performed example, and this is sky. This is sky after the current disease. And this is the minimal invasive surgery and laparoscopic colectomy. This figure shows the endoscopic view of the mean of the Mis for treatment of cancer. And stomos is shown on the endoscopic view. As it's kind of patient maybe complicated the leading anastomosstenosis, intestinal obstruction, and likely lengthening. This is for appendix. Sims mainly aim at stone and stone remove and suppurative appendectics for the endoscopic drainage and others. Sims retract stone not only the retrieval and the drainage, but also maintain the apex is still there. But the miss is apodectomy to remove stone and form mathemating resection apex lead to intestinal adhesion, apex stoma infection. The left figure shows drainage of apex by Sims, while the right side figure shows removed apex. In conclusion, Sims is fully different from Mis. Sims provides a new treatment method for the medicine and specifying the development direction of medicine, while more and more disease diagnosed in the early stage, Sims will be widely used and be leading surgery in the future. Surgery which failure to maintain the integrity of organ will be eliminated. That's all. Thank you, everyone.